So our study was to essentially look at how the retinal and optic nerve disease processes that might affect the outer retina or the inner retina. So outer retina, we talk about things like photoreceptors and the retinal pigment epithelium, the deeper layers, and the inner retina being the ganglion cell complex, as well as the nerve fiber layer. And we wanted to see how different disease processes at the level of the eye, what impact they would have in the central visual pathway, which is essentially the part of the visual system that's inside the brain. So we think that there probably is some degree of degeneration that can take place over time in the context of having retinal or optic nerve disease. So now we have the imaging modalities, functional as well as structural, to be able to see at the retinal level and at the cortical level and the brain level what's actually going on. And we think that'll be relevant in the future, in particular when there's sight restoration therapies that are become more mainstream, like stem cell therapies, cortical vision implants, retinal implants. We need to kind of know what's actually going on centrally in the brain downstream, because once we start to figure out ways to fix the problem at the level of the eye, the assumption that we're making is that the central visual pathway is still unchanged. And so that has great implications for functional recovery, structural recovery, something called cross-modal plasticity, meaning that one area of the brain is naturally sort of geared toward one type of function, but over time, over deprivation, would that sort of switch over to another sensory modality? I think that everyday ophthalmologists will be really excited about this work, given that we're all used to looking at really high resolution images of the retina in the context of OCT, but now we can actually see the brain at that degree of discrete level of processing, discrete level of structural integrity. And I think down the road, when we are sort of offering therapies for people at the level of the retina or the optic nerve, seeing the brain is obviously very important, and knowing what type of processing ability the brain has and how it's changing over the context of deprivation of whatever sensory modality there is. So I think that this will be something in the future that will be really relevant, because the brain is really where most of vision is being processed. And so now that we have a better handle on what we can see at the level of the brain, this will have applications more broadly.